Good afternoon, everyone. I'm Dr. Deepthi. I'm a junior consultant in Aster Women and Child Whitefield. Today we are planning a discussion on gestational hypertension, which is a commonest complication in pregnancy. It can impact 5 to 10% of pregnancies. And today we have Dr. Vishnupriya with us, consultant gynecologist and obstetrician in Women and Child Hospital, Aster Whitefield.
Good evening, everybody. Today we thought of discussing about gestational hypertension, as this is the most common leading cause of maternal mortality and morbidity. So we would like to discuss in detail about the gestational hypertension. As the name says, gestational hypertension is the hypertension which comes during the pregnancy. So coming to what to know exactly what is gestational hypertension. So any pregnant woman who develops high blood pressure, that is more than 140 by 90, 140 is the systolic blood pressure, 90 is the diastolic blood pressure. So any time after 20 weeks of pregnancy is the gestational hypertension.
Coming to risk factors, now there are certain risk factors for gestational hypertension.
Yes, certainly it's the hypertension which develops during the pregnancy. So the most common problem in this disease, exact etiology, means exact cause of the gestational hypertension is not known, but most commonly it's because of abnormal placentation, abnormal placenta, which causes the pressure changes in the mother. So coming to the risk factors, where and all do you see the gestational hypertension, who are at risk? So these mainly the first pregnancy, when the women, if it is a first pregnancy, or when the age of the women is less than 20 years or beyond 35 and 40 years. So extreme ages, we tend to see they are at risk. And coming to the number of gestations, means if the person has a multiple gestation, when they have twins and triplets, they are at high risk. And coming to family history, if her patient's mother has a history of gestational hypertension during her pregnancy, the chance of the patient developing the gestational hypertension is very high. Coming to the previous pregnancy, if the person has gestational hypertension during the first pregnancy, the chance of she developing again the in the next pregnancy is very high. These are the most common things. And coming to the weight of the person, if the BMI is too high, above 30, the risk is very high. Normally 19 point, like if the BMI is less than 19.1 or 19, around 19, yeah, 3.4% of women do develop gestational hypertension. If the person is like above 30, if the BMI is above 30, 35% of women do develop gestational hypertension. And if they have kidney disease, if they have diabetes in their pregnancy, there are other clotting disorders called Aster syndrome, or genetic thrombotic disorders. All these things are the risk factors for the gestational hypertension.
Okay. So can you predict the people who can develop gestational hypertension?
The studies which show us, like, we can antenatally around 13 weeks or all, we can predict these people at high risk. We cannot for sure say, but they are at high risk. So there is something called, we measure during scans the blood flow in the uterine artery, the pressure changes in that can be measured. Accordingly, we can assess the risk of person developing the gestational hypertension. So depending on that blood values and uterine artery PI, we tend to prophylactically give ecosprin, other drugs, and alert the patient.
So we can screen the patient.
Yes, we can alert the patient. We can tell them the chances, the risk alone. And there are certain blood tests also available, enhanced first trimester screening, which will tell us.
So can we prevent this? If we know who are at the risk, can we prevent this complication?
Yes, these are this mainly the lifestyle modification, especially the dietary habits, taking high salt. We should be avoiding it, like pickles, salts, and fried food, junk food, all this tinned food, all this food should be avoided. Dietary modification is the most important thing, and coming to regularly exercising, and in diet again taking a lot of greens, vegetables, and fruits, and at times we tend to supplement them with antioxidants, calcium, and we give them ecosprin. And if they have other disorders like renal disorders and all, that should be or connective tissue disorders, the treatment should be focused on them as well, so that they don't develop gestational hypertension. And if the person is having gestational diabetes as well, so that should be monitored well, so that she doesn't develop the gestational hypertension.
So by following healthy diet and exercise,
Regular
and
exercises,
managing your
yes.
medical disorders,
Yes.
we can prevent.
Yes.
And if once the gestational hypertension is diagnosed, how can we manage it? How do you go in?
So once the gestational hypertension, when do we relabel them? Normally, if the person walks into our OPD with a high blood pressure, we normally tend to we make them wait, and we take one more BP reading. So we require at least 2 BP readings with 6 hours apart. If the BP is above 149, then we label them as gestational hypertension, and then we monitor their BP regularly depending on their gestational age. So the frequent visits to the hospital, the visits to the hospital will increase, and the monitoring of the baby also will be increased. So they'll have to undergo few extra scans because of that, and because of gestational hypertension, they have to undergo few extra blood tests as well, which will tell us what's the condition of different organs, whether the person is going for any pre-eclampsia complications of gestational hypertension. So this is how we monitor. Normally, if the BP is very well controlled and all that stuff, we tend to wait till the term, 38 weeks, 39 weeks. We don't have to deliver. If the BP is not under control, that's when the delivering of the patient takes a decision, or decision of delivery has to be taken if the BP is not under control. Yeah. Coming to the complications of gestational hypertension, we have most common complication is the pre-eclampsia. And actually, it's an extended spectrum of gestational hypertension, where person start throwing the protein protein out of the body, spilling protein along with the high blood pressure is the pre-eclampsia. Most of the times, this gestational hypertension, pre-eclampsia, the blood pressure starts settling after the delivery within 6 weeks. Anything which would persist beyond that, we again label them as chronic hypertension. So other most common other complication is eclampsia. Coming to pre-eclampsia, people do present with multiple symptoms like headache, tummy ache, epigastric pain, like upper abdomen pain, and they can have blurring of vision, and at times in extreme severe pre-eclampsia, patient can throw fit, and we call it as eclampsia. and few other complications like 10 to 20% of pre-eclamptic patients can develop HELP syndrome, which is again an obstetric emergency where there is blood loss and there is liver or damage of the liver as well, so the liver enzymes get elevated and there is a low platelet count as well. So these are the complications of pre-eclampsia. Coming to eclampsia, when a person throw a fit along with all these complications, so the main management would be delivering the patient. So we have to make a decision to deliver, so that the process of this organ damage can be stopped.
We have discussed about gestational hypertension and pre-eclampsia and another term eclampsia. So we can predict the eclampsia, by these symptoms like warning.
Yes. So when gestational hypertension person, when they are deteriorating and reaching the pre-eclampsia can be predicted, because as we'll be doing blood tests on routine basis and their visits, antenatal visits also increase, can be like if we diagnose early and start treating, it can be like the severity of the disease can be reduced. So 0.3% of pre-eclamptic patients will develop eclampsia. This is again one more obstetric emergency, and so pre-pregnancy counseling is very, very essential, as these are lifestyle. Most of this gestational hypertension is a lifestyle disorder which can be the risk of it can be reduced by attending the pre-pregnancy counseling and taking a proper advice.
Like every other disorder, so we can prevent this also by following regular diet and exercise.
Yes.
And mainly this pre-pregnancy counseling.
Yes. It can, at least the severity of the disease can be reduced for sure. It might not be possible to completely prevent it, but the severity of the disease can be reduced. Yeah. So let's see if we have any questions, and we'll take them. Okay. So, yeah.